How to heal a disc injury without surgeries, injections, or pills. What's up, everybody? I'm Dr. Matt Maggio, and I'm the creator of the PEAK method and the founder of the soft tissue revolution, and I'm on a mission to make chronic injuries obsolete. In today's video, I want to talk about disc injuries, specifically disc bulges, disc herniations, and even disc extrusions. So disc injuries are becoming more and more rampant and more common in our society. We spend a lot of time on devices, sitting, not moving how we should. And over time, what happens is it really beats up our muscles and causes big problems. I talk about this all the time, the idea of what's called scar tissue. Scar tissue is like glue that gets inside the muscle, makes it very hard for the muscle to stretch and contract how it's supposed to. Think of it as like plaque in your teeth, but that builds up over time in your muscles. Then what happens is these muscles can't support your joint. So if you think of your disc is in between the bones in your spine, and it's a very good shock absorber. It's very good at handling force like this all day long. Over time, what happens when that scar tissue gets in there, it puts more pressure down on that disc. So now what happens, instead of your disc going like this, it starts to slide and grind on itself. Before you know it, now you got all this pain, and you end up at the orthopedic doctor, maybe the chiropractor, even your primary care doctor, and they send you out for an MRI, but this has been building up over time. The disc doesn't just blow out overnight, it's from repetitive overuse and trauma. Now, when someone does get diagnosed with a disc problem, specifically degenerative disc disease, it can be scary. And it should be, because it is a really big deal. But so many people end up at the orthopedic surgeon's office first before they actually get a conservative method to fix it. So think of your disc as like your thumb, and it's stuck inside a car door. The car door is all that scar tissue. You cannot give your disc a chance to heal until you remove that scar tissue. And what happens is people panic and they freak out because they're in a lot of pain. They end up in the surgeon's office, and there's new codes out there called failed back surgery, failed neck surgery, because they tried to fix the disc first, but they never actually fixed that scar tissue. So how to get the disc to heal without surgery or injections? So the practitioners that are trained in the PEAK method, they are experts at finding and fixing scar tissue. What they're able to do is get in there very precise and very focused with their hands and the use of an instrument. And over a series of visits, they get rid of all that scar tissue. As we do that, the muscles become healthier, stronger, more flexible. And what they do is actually start to decompress that disc and take the pressure off. It goes right back to what we talked about, to the car door and the thumb analogy. And if you remove that scar tissue, you're going to give this a chance to heal up. Regardless, even if you think you need surgery, you need to get the scar tissue figured out first and get that fixed by a trained practitioner. And the best part is you can get access to them by clicking the link below. That will take you over to our website, and you can find out more about the PEAK method and see if there's a practitioner in an area that can help. I appreciate you guys taking the time to watch this video. If you're dealing with a disc injury, you're not getting the answers you want, or you want to try to avoid surgery and not go down that path of surgery, send us a message. We're always here to help. We'll see you guys on the next one. Bye.